Here's a CT that was performed of the abdomen and pelvis in a patient who was presenting with abdominal pain. And if you look at the infrarenal aorta, you can see that there's aneurysmal dilatation here. The thing that's concerning about that is if you look at adjacent to the left iliac artery and a little further up, there's a little bit of stranding here. So in the setting of a pretty dilated distal abdominal aortic aneurysm, we get concerned about whether this is rupturing. We don't see any contrast spilling out to suggest an active extravasation, but it's still somewhat concerning for an intermittent rupture. Now, one of the interesting features is if we go to the bone windows and we take a look at it, you can see that there's this what looks like a lytic lesion involving the anterior portion of the vertebral bodies here. And while one can think about whether this represents metastatic disease, in the setting of an abdominal aortic aneurysm, these can actually pulsate and create areas of relative ischemia to the area of the cortex and eventually lead to this kind of destructive looking change. So this is actually not metastatic disease to the vertebral bodies, but is actually from pulsation from the abdominal aortic aneurysm.